My name is Amy Smith, and I am the academic counselor for the College of Music and Dramatic Arts at Louisiana State University. I work in the Office of Student Success, where our daily efforts focus on enhancing students' well-being as well as enhancing their efforts in achieving their personal, academic, and career goals. We are spending time today with our partners from the LSU Student Health Center to learn more about the services that are available to students and how to access those services as a campus.
My name is Crystal Loup, and I am a coordinator in wellness and health promotion in the LSU Student Health Center. I offer general wellness coaching as well as participate in a variety of promotional activities, encouraging student health and wellness across campus. I also conduct free HIV testing at the Student Health Center in a partnership with the Office of Public Health. And I work primarily in our Lighthouse program, which is a free and confidential program housed in the Student Health Center for survivors or students at risk for interpersonal and sexual violence.
Hi, my name is Dr. John Otzenberger. I'm a licensed clinical psychologist and the director of mental health service. We offer a variety of services for our students, including individual therapy, group therapy, seminars, consultation, and we work very closely with our medical staff as well as our wellness and health promotion staff. We have therapists that include licensed professional counselors, clinical and counseling psychologists, and licensed social workers as well.
Hi, I'm Nelson Perrette. I'm the medical director of the Student Health Center. We offer general primary care in the health center, which takes care of both acute care and some limited chronic care of students. We also have a group of subspecialists who work with us. We have dermatology, ear, nose, and throat, orthopedics. We have athletic training, and we have allergy and immunization clinic at the Student Health Center in the medical department. We also have a laboratory that does in-house laboratory and also sends out lab. So you can get most of your lab in the Student Health Center, and we have an x-ray department.
Wonderful. So to find out a little bit more, where is the Student Health Center located?
The LSU Student Health Center is located on the corner of Infirmary Lane and West Chime Street on the north side of campus, actually right across from the School of Music.
Well, wonderful. We're glad to hear that. So what are the office hours in which students can receive these services?
During fall and spring, service hours are 8 to 5.
What is the mission and vision of the LSU Student Health Center?
I would say the mission, simply stated, is that our job is to keep you healthy during your years here at LSU to help you achieve academic success.
So, and with that being said, what are some common presenting student health concerns or student mental health concerns that you encounter?
In terms of mental health concerns, the number one issue that we see in the Student Health Center is anxiety. And it could be from a variety of things. It could be being overwhelmed with the classes that you're taking. It could be students coming in that are working part-time jobs. Sometimes they're working 2 jobs. So there are financial concerns as well. There could be family of origin issues that they're struggling with as well. Oftentimes we see students that are just, well, they're lonely. And part of that comes from social media, and so this idea that when they see their friends on Facebook that everything looks perfect, that they're having the best times of their lives at whatever school that they're at. And oftentimes we'll hear students feel like, talk about the idea that they're not able to connect with people. And really being in a school with 31,000 students, it's like living in a small city. So you have students that come from isolated areas oftentimes that have never been in a place this big, so they're overwhelmed with that. They go to large classes, and everywhere they go, there are large populations of people, so they can become overwhelmed with that. So we have lots of programs wrapped around this idea of collegiate anxiety and what that means. We have lots of open groups. That is, an open group is a group that anyone can attend. You do not have to sign up for the group. I always tell the students, get there early and get a good seat in back. You don't have to participate. You can just sit back and absorb information from our licensed professionals that specifically talk about issues related to anxiety and transition and loneliness and fitting into the LSU community.
We see a lot of acute infectious processes from respiratory infections such as bronchitis, common cold, influenza. We see sprains and strains, particularly in this age group. We do continuity of care and follow-up of students who come to LSU with a diagnosis of ADHD. We usually follow these students up. However, we do not test for it at the Student Health Center. You need to come with a diagnosis already. We will follow you there. We do a fair amount of STD testing and treatment. And we also treat a fair number of overuse syndromes, which I bring up to the School of Music simply because our musicians have a lot of overuse syndromes from their occupation or whatever.
And I would say in wellness, just so students are aware, if a student does receive a minor in possession charge, we do see those students, and those students will get referred to us for substance use coaching in an effort to reduce their risks if a student is choosing to use substances. And we also see just general, like you were talking about anxiety, we see some stress management students that may not necessarily have an anxiety disorder, but they may need just some support with time management, some basic coping skills, and so we work with those students as well.
Yeah, and I think that goes to this idea of levels of care. So again, there are multiple points of entry in terms of getting into the Student Health Center, and that actually includes levels of care. And so we may have someone who is struggling to get organized in a particular class, and so we can get them to wellness, and those are our experts in terms of helping to deal with time management and stress-related issues in that way. So Crystal does a fantastic job in working with those students. She may notice that there needs to be a different kind of care, maybe an elevated level of care if someone has a history of anxiety, and so she may refer that person to me. She could possibly refer the person to medical as well. And so the idea is to have this collaborative model and with these levels of care so we can be proactive and address these issues before they get to a point where the student can't move forward with their academics. And the idea is to prop the students up and give them what they need with these levels of care so they can be successful in going from one semester to the other and ultimately graduating from LSU. But there are multiple levels of care that we use in terms of getting to that place.
And there are times when the counseling psychologist decides that the student needs to be put on medication, and they will refer them to the medical clinic. The good news there is we just hired a full-time psychiatric nurse practitioner who can prescribe. So we're excited about that.
Yeah.
How can the LSU Student Health Center help an incoming student with getting the immunizations required to be admitted to LSU?
Okay. As you may know, all incoming students are required to have certain immunizations, measles, mumps, rubella. There are a couple others that don't come to mind right now. But we check all those, actually. Every student who comes to LSU is checked through the Student Health Center. And for those who do not have the required immunizations, we can give those immunizations at the Student Health Center and catch you up on your immunizations so you are in compliance with the state law.
If a student would like to learn more about dietary or nutritional needs, what services are offered at the Student Health Center?
We have a full-time registered dietitian housed in Wellness and Health Promotion on the ground floor of the Student Health Center. And she can meet with students to discuss any nutrition concerns that they may have and develop a game plan to target their nutritional and dietary needs. We also have a very specialized eating disorder treatment team at the Student Health Center.
So I know it's very common that interpersonal violence might occur or sexual assault and some time might go by. Is there a time limit if a survivor needs to seek out support services with the Lighthouse program?
No. We will see any student who is experiencing struggles due to having some type of assault in their past. Any survivor of trauma, we will work with them, and again, if we need to refer them elsewhere, we will do that. But we understand that the repercussions of trauma, they last for a long time. Sometimes they can be lifelong, and there are different things in our lives that trigger those traumatic responses. And so a student may experience some type of trigger even on campus. It could be something very simple that happens that really caught them off guard. They become emotional and they're reminded of something from their past that was really very scary for them. We certainly want that student to come in and utilize our services because we understand how trauma does affect our survivors, and we will not try to rush anybody into recovery or healing if that's not where they are in that moment.
Well said, yeah. The idea of trauma, oftentimes it is delayed. And so we see that all the time, and that's sort of a normal function of trauma. And so if you begin to experience triggers, I would say come in immediately. It's a really safe place to land and to actually get some support.
We are so grateful for the time that we spent today with partners from the LSU Student Health Center, learning more about the areas of medical health, mental health, and then general wellness and health promotion. We are excited as the goal with the Office of Student Success is to enhance our students' wellness through the services that you provide. So thank you so much for sharing, and as students, we invite you to be partners in this process as well.